Hello, everyone, at our regional meeting where we continue discussing the influence of COVID-19 on the work of the penitentiary services worldwide. And today we have our national experts from Armenia, Georgia, Moldova, and Ukraine joining our meeting to discuss access and the right to access to healthcare services in the temporary detention facilities. And I would like to give the floor first to our expert from Armenia, to David. David, could you please tell us what are the instructions given in Armenia to handle the COVID-19 pandemic in penitentiary facilities, and if the government has elaborated any specific instructions to respond to COVID-19 cases in the penitentiary?
In case of Armenia, we had to highlight the importance. There were, first of all, it was the emergency, state of emergency, and we had the emergency commandant, and they had the decrees in which they followed, and they had specific measures regarding to the penitentiary institutions and the temporary institutions. And we had, in terms of overall response of the healthcare system, we liked. In the beginning, we were handling very good in the situation, but like in mid-summer period, overall the situation in the beginning of May, April, we had the situation gotten worse there. And what the government did is we had the institution, like we call the penitentiary medical center, and we had the convicts hospital. What government did is, through the support of the international organizations, local organizations, they had this specific area in the hospital to have the places for the quarantine and for places for the isolation. What was important is to provision of the needs of specifically personal protective equipments. The government also bought extra masks, gloves, face shields for the staff, as well as for the people deprived of the liberty. For one thing, for specifically that the Armenia did is specifically this convicts hospital. They had 150 beds in the specific area to have the ones and isolate the ones who had the pre-existing conditions. But very globally to have to focus on these institutions as a very specific places, and as in the general context of COVID, I would say that we could have the response could have been better, but which has been highlighted also by the independent observer groups, that we need extra focus on these institutions, taking into account that the people living there are mostly vulnerable, and further restrictive measures we're not clearly communicating with the ones that were already restricted. And I would like to highlight also the importance that in this region we had, and overall in the world, we had some successful examples of handling with tuberculosis, with HIV and AIDS, and the information that could have been generated, collected, and the data that we had previously could have been a ground for effective measures and taking into account in the COVID related. We had the specific project, the penitentiary institutions had specific measurements, but each of these measurements were following, and they were for pro-isolating, and they were the ones that the quarantining and the isolation and the external relations with the contact with the external world, that these kind of measures were even deepening this issue of the contact of the outside world with the people already deprived of the liberty. And this overall, this situation was the following to I would say the isolation, quarantine, and the testing. They were emergency measures were taken into account in the beginning, and the ones who were, especially in the temporary detention centers, were tested, and the isolation and the quarantine were made. But we had double crisis in Armenia, and we also, the worst situation that we had recently, and the overall problem in the access to the healthcare and the healthcare situation in the country was kind of collapsed, and that couldn't have just go and do not touch to this kind of institutions. And we still need to collect the data from the institutions, from the response, because the latest data that we have was about in all the institutions, they had only 2 positive cases by the end of the August and September. So we need to, and all the experts need to refresh the data regarding to the institutions. But we had many cases of the staff, and the staff is mainly the ones who is bringing and the ones who are commonly in contact with the people in the penitentiary institutions, and especially the precautions and the personal protective equipments that available and accessible should be firstly given to the staff, and the staff should have the access to this equipment in order to prevent, because in the case of COVID, the prevention should be the main focus of the government, but in this regard, also not to forget about the rights and all kind of deprivation. The extra deprivation should be the reasonable, and everyone should have to clearly communicating why these measures were obtained.
Thank you very much, David. I have a clarifying question to you. If there was access to testing provided to people detained at the police stations, in temporary detention facilities, so how realistic was the access to testing provided to people in penitentiaries?
Testing overall in Armenia was a big problem because the cases were rising, and access to the testing was a big issue, especially during the high levels of the outbreak times that we had. In the police stations, from my experience, I would say that not everyone, that there are different kind of tests that are, but the ones that are providing the results more accurately need some time to wait for the results, and this is something very important to consider in this regard, because in the temporary detention centers and the police stations, the overall architecture of the centers were not, I would say, well constructed in order to maintain this waiting period. I mean, you need to give the test and you need to wait for the results and to following the steps. I think I would say that in terms of the general testing problem and the access to the testing was also clearly visible in terms of the police stations and the places of detention, taking into consideration and taking into account the fact that the testing, and especially mass testing, were one of the key actions to fight against the COVID-19, which was not possible fully. And that was the problem, I would say, of the general testing capacity of the country and the needs of the testing, especially in of the people who have pre-existing conditions, even out of the detention facilities. But I would definitely say, because I see that this issue is still actual in the primary sector, and taking into account that the close cooperation between the primary level, the hospital level, and the penitentiary institutions are not very strong, I would say that definitely this is something very important, something that happened. And something that I would say that in the police department, they were not enough timing period for the test results. First of all, the temporary detention centers, I would say that from our experience, where testing capacities were not enough, and overall but in the prisons, where it is about the prisons, and it was the closed, even the other isolated regions. I mean, the ones who entered the prisons already, they had to have the COVID test and the negative test. And the ones, first of all, screened for the COVID symptoms. This was something very initial. But as we had the overall picture of the country was, and the process of handling and the fighting against COVID was really hard, and is still really hard. These issues are very actual and very problematic in terms of the penitentiary institutions and the temporary stations and the police stations.
Thank you very much, David. And now I want to give the floor to our expert from Moldova. Svetlana, could you please briefly describe the situation in Moldova since March, and if there have been any guidelines and instructions given for the penitentiaries specifically? And also, please respond to the question if access to testing was provided in temporary detention facilities. Yes, thank you very much for this questions and for giving me the floor. Of course, it is difficult to say that COVID appeared in our countries gradually. Of course it did, but I think that COVID-19 became actually a catalyst of those problems that had existed in the specific healthcare facilities in the penitentiary that are not subordinate to the general public healthcare system in the country. Of course, we need to say that the healthcare system did respond quite quickly to COVID-19. On March 12th, already the red code was, the instructions and guidelines were elaborated for the healthcare facilities, even 5 days before the red code was declared in the country. So again, there were restrictions for visits to the penitentiary, also for visits of the NGOs that provided certain services to the penitentiary. But by mid-April, everybody realized that the process took longer than they had existed. So that's why certain measures were made to actually compensate for the restrictions. Like, for instance, the time for telephone calls was doubled, and some other means of communication were promoted. So also, the meetings between healthcare specialists were mostly conducted online, so the prisoners could actually communicate with their doctors online, and only if urgent, they actually could have a visit of a doctor in the penitentiary system. But unfortunately, by the moment the epidemic started, there was no epidemiologist in the penitentiary healthcare system. So it was the moment when the healthcare system in penitentiaries realized that they needed to develop a certain emergency plan for such a situation of emergency, to trace the contacts and to prevent the outbreak in the penitentiary. Of course, our international partners really helped a lot. For specifically UNODC Moldova office and the central WHO office helped elaborate specific healthcare procedures for the penitentiary, and to elaborate a specific scenarios, I would even say, for healthy people admitted to the penitentiary and for suspected cases appearing in the penitentiary. And it happened even before WHO elaborated global recommendations and guidelines for controlling COVID-19 in penitentiaries. And Another problem was that the general public healthcare system elaborated guidelines that never mentioned penitentiaries in the text. And the reason was they said, well, you have your own ministry and you have your own departmental or sectoral healthcare service. And this situation actually persists. Even today, penitentiaries and prisoners are not mentioned in any guidelines, instructions, or orders of the Ministry of Health. However, I would say that the Ministry of Justice has issued 8 orders that actually partly copied and also interpreted the orders and resolutions of the National Ministry of Health, and also gave recommendations how to adapt the overall national healthcare instructions and guidelines to the specific needs and conditions of the penitentiaries. And again, we know that, for instance, in 5 penitentiary facilities in the country, there was no doctor provided. They only had nurses and, so to say, mid-level medical staff. So that was also a challenge. And then later, online trainings were organized for all the staff, healthcare staff of the penitentiary system, specifically for COVID-19 prevention and management, and also testing was done for the population of the penitentiary, and the tests, actually, the samples were recovered in penitentiary laboratories, but the testing was done by civilian laboratories later to territorial civilian laboratories locally. The first COVID case in the penitentiary was registered in April. It was a person who came from Ukraine, and he was COVID. He tested positive for COVID-19 during temporary detention, and his status was not confirmed at that moment, and he was isolated, and GPRS monitoring was provided for this person. And that was the first case when the Moldovan penitentiary system actually faced a COVID case. Later on, in July, we had the second case of COVID-19. It was actually a situation when the lawyer and a prisoner and his lawyer tested positive for COVID-19. So the case was highlighted in media, and there was a rise in fear of the people working in the penitentiary, because previously they only knew some information about prevention provided by the Ministry of Health. So they didn't know how to treat such cases. There were no resources to treat COVID cases in penitentiary hospitals. That's why this infected case, had to be transferred to a civilian hospital for treatment. Today we have only 9 active cases of COVID-19 in the penitentiary, and all these people now are getting the treatment in penitentiary hospital. So again, the problem of COVID-19 revealed a whole range of issues in the penitentiary healthcare system. It became clear that there were no specialists, no infectionists, and no equipment to provide necessary assistance and treatment. That's why it was decided to transfer all COVID cases among prisoners to one specific penitentiary hospital. There a special department was allocated for COVID treatment, and certain equipment was also concentrated there. There was also an agreement with the Ministry of Health achieved that in case the health of a patient actually deteriorates, then the patient would be transferred to a civilian hospital, to the resuscitation unit. Again, the Ministry of Health and WHO office in Moldova actually provided consultations. There was a WHO expert who works for the infection disasters, infection emergencies. So he actually consulted the penitentiary hospital about how to allocate the COVID patients, how to provide isolation, and how to provide infection control in the hospital. And again, regarding the efficiency of the measures, we can say that 270 people among the workers of the penitentiary tested positive for COVID. One of the people died, and currently we have 41 active cases among the staff. So actually, there are people with COVID-19 among the staff of all the penitentiaries. But still, we can say that even this, though this figure is not very low, it still tests to the efficiency of the measures, because it could have been much higher. And I can say that the healthcare system in the penitentiary was up to the situation, up to the pandemic, even despite the fact that there was not so smooth cooperation with the National Ministry of Health. I also visited some penitentiaries, and not only prisons, but also temporary detention facilities and facilities at police stations, and I could see the difference between these, because for the penitentiary healthcare system there were very clear guidelines given, and the guidelines were incorporated into the work of the penitentiary prison facilities, whereas we could not see this compliance with the guidelines in the temporary detention facilities. So I think that there should be an effort, a joint effort of psychologists, infectionists, prison healthcare staff, etc. And by the way, some such trainings were conducted in September, supported by the Dignity Institute. And I think that situation is going to improve, and we are going to cope. Okay, now I want to ask you, Akaki, what is the difference between the situation in the penitentiaries of Georgia from those in Armenia, in Moldova, if Georgia has had any specific guidelines related to COVID-19 for the penitentiary, and what about access to testing for prisoners?
I'd like to speak about the penitentiary system and also about the TDIs. These are two different systems. TDIs, these are temporary detention isolators. So when we are speaking about protocols, about guidelines, we have nationwide guidelines adopted by the Ministry of Health. At the same time, of course, there are local guidelines for the penitentiary system, for TDIs they follow. What I want to mention from the beginning is that in penitentiary system, like there was no COVID detected yet, because they had special measures taken. I mean that they imposed special regime, restrictive regime. It means that the personnel was locked inside the prison, and so they had to control the situation from inside. The situation changed time by time. Previously, they were locked there for 3 months, but after they were locked there for 15 days, and then they could leave for 10 days and go home, because after 15 days of work, they were tested, like they had this PCR test, and then they could start to work again. So this is the system that is working there. That's why the restrictive measures, because of these measures, they don't consider it necessary to test prisoners inside. So this system is working there. As for the TDIs, they have very simple procedures. When a detainee is accepted, they are measuring the temperature, and if the temperature is detected, then they have special centers, and they're transferring them to the special centers. As for the healthcare of detainees, what I'd like to mention is that, of course, during the nationwide lockdown, the number of detainees have been decreased in general, but still, they accepted detainees, and they had to provide medical service in temporary detention isolators and in penitentiary system. As for the penitentiary system, I can tell you that if a person needs, when we are speaking about restrictions, they were restrictions imposed for getting medical health care as well. I mean, if previously doctors and some medical specialists would enter the prison and give consultations, now there are restrictions, so it's not easy to enter the prison. Unless there is an urgent case and a prisoner needs to be transferred. If a prisoner is transferred to a hospital, after this, after getting care and having this medical service, the prisoner is tested. They make PCR test to the prisoner, and the prisoner is not directly returned to the establishment, but is transferred to a special establishment. We have special establishment number 10, and the prisoner has to remain there in this establishment for a certain period of time. It's 12 days. So even though the PCR test tells that it's negative, still the prisoner should remain there for 12 days. And after this, the prisoner is allocated to the establishment that it came from. As for the TDIs, the procedure is simple. Like in Georgian TDIs, we have doctors employed inside TDIs. So they have they are part of this TDI system. So we have currently 29 temporary detention isolators in Georgia, and most of them have doctors employed there. They have their own special room, and if they are they are mostly available for 24 hours. But there are, of course, TDIs which don't have doctors. In these cases, there are two procedures. First, they call ambulance, or they have doctors on a contract. So at this case, there are exceptions in some TDAs, so they use these two other forms of calling a doctor if they need in these cases. The monitoring showed that there were no problems in terms of transferring detainees to get a medical service. If they need this urgent service, it's quite easy to get it. But as I mentioned, the main problem here is still getting the full medical service in terms of medical consultations, not only urgent cases. And this is suspended in penitentiary system.
Now I want to give the floor to our Ukrainian expert, Valentina. Could you please compare the situation in Ukraine to those in your geographic neighbors? And could you please also describe your approach? Thank you. On April 1, 2020, in Ukraine, reforms started among the funding of healthcare facilities. And so the civilian healthcare system actually started a new reimbursement scheme. And that actually confused the situation a lot, because first the healthcare facilities had to start implementing some new rules that they had no experience in. So there was a problem in communicating between healthcare institutions. There was a problem in reaffirming samples for testing. So it was not quite clear how the samples had been transferred to public health laboratories, etc. So for several months, there was total confusion in the healthcare system in terms of procedures. But still, the Ministry of Health quite promptly issued the guidelines. Like actually, the very next day after the state of emergency was announced by the Cabinet of Ministers, the Ministry of Justice actually approved guidelines for the penitentiary, and then every prison or every temporary detention facility elaborated a local algorithm or a local emergency plan. So there was a response, I would say, to the pandemic, but again, the response was mainly on paper, and there was a very challenging situation in terms of implementing all the guidelines and practice, because of the at the very beginning, because of the reform in funding, there was a lack of resources, lack of personal protective equipment. The biggest problem was access to testing, because if there is no testing, there is no disease. So from the Ukrainian media, one could say that there is no pandemic, no disease in the penitentiary system in Ukraine. But in the reality is different. I think that testing of contacts is very important for preventing the disease from penetrating the penitentiaries, because actually the contacts in the penitentiary are people working in the penitentiary, the staff. Actually, I would say that according to the guidelines, the staff of the penitentiaries have to even change their clothes after they arrive to the penitentiaries using public transport, for instance. They have to undergo certain hygiene procedures before they start their working day in the penitentiary. But of course, not all of them complied with all these requirements. And there are no specific procedures clarifying how the people from the penitentiaries are going to get. And actually, we Ministry of Health also elaborated a package of measures to address COVID-19 that envisages mobile teams that recover samples for subsequent PCR testing, but these mobile teams did not know how to handle prisoners. So again, they had certain guidelines for the civilian population. They knew how to recover samples from those patients that were referred to them by family physicians, but they did not know how to test prisoners, because prisoners were referred to such mobile teams by prison doctors that are different from family doctors, and that's why the referrals from prison doctors were not considered equally to referrals from family doctors, and that actually created a vacuum, I would say, a huge gap in testing. And this is how we missed that first period that was very critical for preventing the disease from penetrating into the penitentiary. So we failed at that moment. I mean, the prison healthcare system failed at that moment in arranging for the testing, and it failed in adequately responding to the disease. Today, we cannot actually speak about reliable information about the number of cases in the penitentiary. We do not trust the data that are published. I can say that the population of prisons did not decrease during the pandemic, though I would say that the number of people detained at police stations did decrease, and in most of the cases, courts today prefer home arrest, for instance, to temporary detention in special temporary detention facilities, which helps decrease the population. I would not say that the penitentiary system responded really efficiently, but they are actually continuing to take effort, and we do hope that this situation would improve. By the way, we have a whole range of institutions that are at higher risk. These are geriatric institutions or elderly homes. We have asylums, etc. And we do not have any insider information for 2021 yet, though 2021 is coming in 2 weeks. So it's a little bit scary. We do not know what to expect in 2021. And I can say that penitentiary healthcare, prison healthcare cannot be efficient without efficient healthcare at the public level, at the civilian level. And now I want to continue the topic of cooperation that was mentioned by some of the speakers, specifically the cooperation between the healthcare in penitentiaries and the public healthcare service. And I want to ask Valentina first. Tell me, please, what is the access to healthcare in penitentiaries? And at the level of police stations, in temporary detention facilities. So what is out there, and what are the bottlenecks that the pandemic actually revealed in the system? Temporary detention facilities and the police stations received specific orders on how the civilian doctors had to cooperate with those. But the police stations do not have their medical staff of their own. So if any medical service is needed, they call the ambulance, or they ask a civilian doctor to visit. So it's easier at the police stations, but in penitentiaries, they have healthcare staff of their own, and the healthcare facilities in the penitentiary, they provide primary health care, and if for the secondary health care, they need to refer the prisoners to the civilian system. And since there was a huge reform in the civilian system, the people in the civilian system did not know how to handle the patients referred from the penitentiary. And by the way, at that moment, we also had a change in the system from paperwork to electronic. And so some penitentiaries do not have any electronic database. They cannot send any information, any patient history electronically to the civilian healthcare system. Then the civilian system has a lot of questions. They do not know who is going to pay for this patient. So most efficient way has been the family members asking help from the family doctor. Then it was easier. So officially on paper, there is no restriction of the right to help of people who are in detention. But in reality, in practice, it is very difficult to provide any specific or specialized assistance. We also have a temporary detention facility that is subordinate to the security service of Ukraine. They have their own healthcare system. They have a military hospital, and there the situation is quite okay because this military hospital actually provides services to the staff, to the military staff, to the staff of the security service, and also to people detained or imprisoned within the security service. But the situation in penitentiaries generally is very poor, I would say, in terms of medical services. It's not only about COVID-19, but it's about some other services. Now I want to give the floor to our expert from Moldova, to you, Svetlana. This year, Moldova elaborated a special guideline for the access to the right to healthcare for the penitentiaries, for detainees. Can you please tell us a little bit more about if these instructions and guidelines have proven efficient and helpful in handling COVID-19? The instruction, the guideline was approved on the 15th of November last year. So I even remember the date of this instruction, of this resolution, because it was a very useful resolution with very specifically written procedures. It is a big document, about 20 pages, and it sets out a lot of procedures for the access to healthcare and access to all rights associated with healthcare, also at detention. And so it also contained instructions for the healthcare staff and non-medical staff. And when I say medical staff, I mean the medical staff of those centers that work in the penitentiary system and in the police. So today we have 15 special police centers that provide for 72-hour detention. And so that's instructions specifically addressed these centers. And again, the problem in these centers is the lack of medical staff, medical workers, and there is no understanding whether who should work there. Should it be a doctor? Should it be a feldsher? Or should it be a nurse? And of course, it really matters because these different levels of medical staff are different in terms of their competencies to make health-related decisions. During the monitoring, after the guideline was issued, we could see different cases and different experiences. Like, for instance, in some cases, the heads of these temporary detention centers were quite happy to welcome the experts from, for instance, international committees against torture and some other international organizations. And most of them were quite eager to make the situation better. But unfortunately, I would say that only one training was conducted, and one training is not sufficient to ensure implementation of the even brilliant practices and brilliant instructions. And when we speak about COVID, this instruction actually contains the general instructions for provision of healthcare. And also, by the way, it contains a special block, a special unit related to infectious diseases. It also contains some tips for infectious diseases in general and tuberculosis specifically. And by the way, prevention and management measures for tuberculosis are very similar to those of COVID. But of course, these procedures, when they were elaborated in November last year, did not mention COVID, and nothing COVID specific was elaborated later during the year. But I would say that so there are some practices that remain unchanged, like for instance the presence of a police officer during a medical check, or for instance the procedures for transferring medications from family members to the people in detention, or like for instance there are some procedures to be detailed, like procedures for hand washing and some other hygiene procedures. And these procedures need to be elaborated further because they need to actually follow the experience of COVID-19 that we have accumulated. So we need to know generally what to do, and we need to know what to do in a situation if a detainee tests positive for COVID-19. At the onset of the epidemic, the emergency commission made a decision to transfer detainees to custody, not in 72 hours, but in 7 days, because it was clear that they had to keep the people for 7 days at a special detention facility to prevent people with COVID-19 from entering the penitentiary. Of course, there were some efforts to decrease the number of people in penitentiaries, though I wouldn't say that those efforts were successful. So the prison population did not decrease largely. Though, again, at local police stations, the police itself took certain measures. They used face masks, they washed hands. Though, of course, all those practices of using PPE, of discharging PPE, of wasting, of treating and handling the waste were not sufficient. And now I have a question to you, David. Could you please tell us what is the level of cooperation between the penitentiary and the police and the healthcare service in Armenia?
As I mentioned already, there is under the Ministry of Justice there is a penitentiary medicine center, and they are mostly dealing with the cases that they have in the penitentiary institutions. And also in case of Armenia as well, when there is a specific need of a doctor that couldn't be provided by the center, they are inviting from public or private hospitals. In case of the provided services as well, if this service is not possible to provide in the hospital of the convicts hospital, they transfer the person to the public hospital, mainly public hospital. But this is in case of the COVID and the overall the healthcare situation and the situation in the related to the people deprived of the liberty. I also want to join the idea that this brought up the problems that we were facing before, and they were problems that were highlighted in the reports, in the messages that we were organizations, the governments and the international organizations or local NGOs were highlighting previously. this is one of the biggest things that could also support to the fighting against the COVID is the staff and the professional competencies of the staff, especially in the penitentiary in the hospitals that convict hospitals, I would say in this case. There was in other countries, in case of the other countries as well, in Armenia, the doctors and the professionals working in the institutions were trained, and there was a very good example of the NGOs, international organizations, and National Institute of the Health and the Ministry of Healthcare, and the joint efforts were organized training, online training for the staff working in the hospital. But I would say that there was also, and there is still, a need to give the accessible information to the persons deprived of the liberty in the language and the way that they understand, especially in the COVID and especially in the preventive measures, about the preventive measures. And also I would say that the adequate personal protective equipment and the measures and the provision of these measures were really important. And it is very important also in terms of the cooperation between the public and the state hospitals and the penitentiary medicine centers, because in the case, whenever we are talking about the sizes of the support or the sizes of the work, in case of COVID, we had many people who suffered from COVID, and we had very good knowledge, generated knowledge in the public sector, in the hospital, which could have been transferred to the penitentiary institutions and the medical service providers in these institutions. And also, whenever we are talking about the effective measures and effective cooperation between the agencies, it is very important also to highlight the financing. Yes, the overall healthcare financing in the country, especially focusing on the places where people are deprived of the liberty and the closed institutions. And in regard of in Armenian case, there is a free access to the healthcare for every prisoner. And but however, if there is a free access, we still need to think about the quality of the provided services and the importance to highlight the multidisciplinary approach to the services, because the dealing with the people who are deprived from liberty, and especially in the public clinics and public hospitals or private hospitals, I would highlight the lack of skills and the lack of professionals who can have under multidisciplinary teams, and the approaches in this regard, which would be very helpful in terms of general provision, the effective provision of the services, but in terms of COVID as well. This is very important. And also we are talking about the provision of the essential services, but the rights of the confidentiality, which is very important, that I think I would like to highlight in this case, because this is an information about the person's healthcare status, especially when we are talking about the pre-existing conditions. Regarding general preventive healthcare, we saw that in the countries that there is a strong focus on the preventive care, they are dealing better in the situation, and especially in the institutions as well. In the institutions that are highlighting the importance of the preventive care, and they are having these sanitary regimes, and they are having these staff are going through regular trainings and the regular capacity building activities, we see that their approach is much better. We see that their approach is more effective, and also to go back, collect the data that we had previously. We were highlighting also the tuberculosis, the fight against tuberculosis in the institutions, also to add the information that we collected in this regard in the COVID, to really efficiently collect the data. The experts and the multidisciplinary teams need to collect the evidence, follow the evidence, make guidelines for the previous outbreaks, for the next outbreaks, I would say. Because these situations, we can say that we were effectively handling the COVID, but we are not, we can't be sure for the next outbreaks, for the next even small outbreaks. We're not talking about the general population or the worldwide outbreaks. Even small local outbreaks, everyone in every facility, in every organization should have everything facted, everything papered, everything written in the paper, and just in case of the emergency or in case of the situation, just to take and not focus on institutional memory rather than the persons and rather than the people. And this is very important in terms of COVID as well. And I hope that our countries and our governments, and in support of the civil society and the international organizations, will effectively document the lessons learned, the measures taken, and the successful cases from different countries.
Thank you very much, David. And my question to all the experts is as follows. So how do you assess the quality of statistics in your country? And was any attempt made to analyze the statistics by risk groups in the penitentiary, like separately for people over 65 or people with some pre-morbidities, some medical conditions? Has the statistics been analyzed to single out these risk groups? And have there been any discussions about the potential measures, like for maybe substituting custody with home arrest or any other measures, or maybe isolating, like for instance, elderly in prisons from the rest of the prison population to improve their safety there?
Yes. First of all, I'd like to clarify that on the one hand, we have statistics that there was no case of COVID-19 discovered in penitentiary systems. However, it had very strong human rights implications. Why? Because, like, when we're speaking on the restrictive regimes, it means that we are trying to make a strong restrictive regime which somehow restricts the employees, the staff of the penitentiary system, makes them be inside in the closed environment, and it is a big stress for them, of course, and of course it will have different implications in the future. And I don't think that it is a human rights based approach, and I don't think that it is an outcome that can be considered as a successful one, even though no cases of COVID-19 were there. So I think that it is very important to have a special plan which has the impact, which analyzes the impact that each measure should have on human rights. And so the plan should clearly see what kind of measures should be implemented and how we are going to compensate the restrictive environment that we have there. So at the same time, we know that SPT had special guidelines and was advising to assess the risk of the most vulnerable people in the penitentiary system. And one of the main recommendations was to release prisoners as well.
The most ideal situation that would satisfy me and the public would be testing all the people coming to the penitentiary system, and all the people who show some respiratory symptoms had to be tested as well. But of course, we do understand that this is not something possible, not something feasible, I would say. And by the way, for quite a while, the Ministry of Health failed to adopt a general guideline for COVID-19. I mean, the final one. They adopted a temporary protocol, a temporary guideline, and the healthcare system had to adopt and adapt also this temporary system. But the temporary procedure had a very limited range of criteria for testing. It included actually only being abroad recently and contacts with foreign citizens. So it really narrowed the number of people, potential contacts who had to be tested. And I think that all the measures that have been implemented, the fact that all the prisons allocated certain spaces to quarantine the people who were newly adopted to the newly admitted to the prison, it was also already a good step, because it means they realized how to split the inflows of prisoners, and how to provide monitoring over the newly admitted people for 2 weeks. And actually, it also restricted the circulation between prisoners. Between prisons, sorry. And this circulation is very high in Moldova, because about 40 prisoners are annually transferred from one prison to another in the country. So, again, we also have to analyze today what has happened in the penitentiary. We need to collect the data about the infections, about the cases, about the resources used, the number of PPE used, the number of PPE remaining, etc. But unfortunately, this information was never published. And even data that were published were absolutely differently interpreted by the general population and by the population in prisons. And the lack of information was actually something that really was alarming, because the prisoners knew what was happening outside the prisons. They could see that there was some panic outside, a lot of measures were taken, and they had the perception that out in the outside world, everybody cared about the ordinary citizens, but nobody cared about the prisoners. Nothing was done apparently for them. And that, of course, triggered panic in prisons. Today we have weekly data about how many people have been admitted to prisons, how many tested positive. And today we have some statistics about the cases among the prison population and prison staff. So that has helped to actually calm down the people a little bit. It has provided information to the prisoners and to the general public. But again, I wish there was a mandatory screening for COVID-19 during admission to the penitentiary, similar to TB tests, to hepatitis B and C tests. Speaking about the Ukrainian penitentiary system, again, if we take official statistics, then by mid-November, over 2,000 people were tested and 240 tested positive. So again, we cannot say that this is really representative, because we have more than 30,000 people in penitentiaries in Ukraine. So we cannot say that these statistics really reflect the real situation in the penitentiary and in temporary facilities, temporary detention facilities. And the major objective was prevention. And when the pandemic started, even though there was a lack of PPE, a lot of NGOs jumped in, some religious organizations also jumped in, and they helped the penitentiaries, the prisons, with PPE. Of course, it would have been better if all the people admitted to the penitentiary had been tested not only for COVID, but also for flus and all other infectious diseases. Because in terms of the epidemiological monitoring, COVID-19 is no different from a flu. Of course, it has a little bit different risk groups, but generally the procedure would be the same. And another difference of COVID-19 is complications that are more difficult for the healthcare to manage. So again, if there had been elaborated guidelines for testing at admission, I would say the situation would have been better. But again, we could clearly see that there has been a problem with detection. Many people had COVID-19 without even being tested or diagnosed. I even know some people personally. And I think that we need to focus in future on the access to testing. And because the access to testing hugely influences the quality of statistics in the country. Today, I cannot say that testing is accessible. Usually, it takes a week to get a result of the PCR test at a public healthcare center. So we have a whole week during which we do not have any diagnosis. Forgot to respond to your second question about the vulnerable groups of the prison population. Unfortunately, when the pandemic started, there was no specific approach to prisoners who were older than 65, or there was no approach for releasing people from from prisons. Even I would say the contrary happened, because some judges became ill, and some people who were actually detained temporarily had to wait longer for court proceedings, etc. So there were some measures that restricted the rights of some of the detainees who could have been released otherwise. So we have a special list of diseases that are reasons and grounds for release from prisons. But these are very severe, very, I would say, deadly diseases. And even with those diseases, the applications take very long to consider. The movement of the prison staff was also restricted within certain units. And that actually really proved very positive. We also have a very good system of video surveillance, centralized video surveillance, and special video monitoring was also introduced over the prison staff to detect cases when the staff did not wear masks or moved between different units of the prison. And then the results were discussed internally in prisons, tried to explain the behaviors of the staff, etc. When I visited prisons, I could see how many mistakes were made by the prison staff in terms of mask wearing at the beginning, and I could see how the situation improved later, because people realized that it was really necessary for health, and also because they knew that they could be punished later for the blunders. And we still have the problem with overcrowding in prisons because the prisoners are not evenly distributed between prisons, and there have been no specific measures made to release certain high-risk categories of prisoners to make the situation better. Okay, thank you very much, Svetlana. And now I would like to give the floor to you, David.
In terms of the statistics, we receive daily statistics in the country level from the Ministry of Health about the daily tested performed, positive cases, and about the date rates. We don't have any specific mandatory information sharing from the penitentiary institutions. And about the cases that we know, they were coming from the official, as an answer to the official requests to the institutions. So, I mean, if there is no request to the institution or the Ministry of Justice, there is no specified information about the penitentiary institutions and the statistics in the penitentiary institutions. In this regard, we have the tool that civil society actually has is the public oversight in the penitentiary institutions, the monitoring group, and the monitoring group is actively working on the within the visiting, seeing the situation and protection of the human rights, healthcare personnel, and delivery of appropriate healthcare, and they are also the ones who are actively monitoring the situation and the COVID-related situation in the penitentiary institutions. The last publicly made statement about the statistic that we have is in the end of the August, that we had only 2 cases confirmed in the penitentiary institutions, and we had, but the overall about 157 tests were made, and only 2 were positive. But we had in the same time period, they were performed about 350 testing in the among the staff, and they were 71 of them had a COVID. So we see that referring to the personal protective equipment, accessibility, and the availability of the equipment, we see that this is a quite big rate of tests performed and the positive tests that we had.
Thank you very much, David. Now we are getting closer to the wrap up of our meeting, and my last question to our expert is as follows: what would you change in the police approach in terms of ensuring the right to healthcare services based on what you have learned over the recent months? And what do you think are the projects that should be implemented nationwide, countrywide, and what initiatives should be legalized and rolled out in future? And this question first goes to you, Akaki.
I think the most important thing is to make a special plan on preventive measures. Also, it is very important to have testing, of course, but plan is something that can make can assess the situation and take into consideration like human rights issues and also the measures that are important to protect the system from COVID-19. So I think it is very important to cooperate with different actors. So state institutions should cooperate with non-governmental organizations, with international organizations, and it should be the process should be transparent, and it is very important. This plan will help this system to see what are the main challenges and also to plan concrete actions on how to respond to them. When we are speaking on different measures, it is very important to take into consideration the impacts that the measures can have on detainees, and it is the obligation of the state to compensate. If we have restrictions on family visits, it is very important to compensate with different means, such as video calls and other measures. If we have restrictions on parcels, it is very important to compensate with other means here as well, such as like making the food giving them more opportunity to have a different type of food and have access to more fruits and other type of other food that is important in prisons. So I mean, it is very important to have this clearly elaborated plan with concrete actions, without of which it is difficult to manage this system. And also it is very important to have conditions for personnel to make to give them adequate compensation for the work done. Also, it is very important for them to have adequate time for having a rest and really to release the stress they have there. I think it is also important to have campaigns and giving more information to detainees about not only about protective measures, but also some issues, giving them information about some hygiene and all other important aspects that are important to fight against COVID-19.
Some plans in our country have been already elaborated. I think what we failed in was we failed to take the pandemic seriously, to take the quarantine and lockdown seriously. We all thought it was very temporary. That's why some institutions did not hurry to buy PPE. Of course, today we would have responded differently. We would be a big plan elaborated by the Ministry of Health that would apply not only to the civilian population, but also to prison population. And I think this plan should include the guidelines for prisons specifically as well. So it should not be some internal document elaborated by the Ministry of Justice, because prisons, colonies, temporary detention facilities, they are not autonomous states. They are not independent facilities. They are part of the overall society and overall population. And they, in case of crisis, they are in a vulnerable situation because the funding there is poor, etc. So I think in such cases, in such emergencies, the Ministry of Health should assist the Ministry of Justice in elaborating adequate measures, adequate guidelines, so that the people in the penitentiary would rely on the civilian public health care. And well, okay, we understand that the systemic problems are still there. And one of the systemic problems is the independent medical staff and the adequate medical staff. So the lack of physicians in the penitentiary system is a huge barrier to implementing any measures, be it COVID-related or measures related to any other disease. At police stations, in prisons, the health staff are subordinate to the prison staff or to the police. So they are not subordinate to the Ministry of Health. And sometimes they do not comply with the guidelines published by the Ministry of Health, because they are dependent on the prison management. And again, of course, we need certain guidelines for action, and they need to be taken into to take into consideration human rights. Human rights as set out in certain human rights in documents elaborated by the human rights institutions. So far, the guidelines elaborated in our country were only based on WHO guidelines without taking into consideration the human right aspect. And also, I need to mention that I would like to mention the really very fast response of donors in the penitentiary system and international donors working in Moldova in general, because they really helped very fast to buy PPE and by the penitentiary system added their own money to buy some extra PPE. And also, during the monitoring visits, we realized that, of course, donor assistance is good, but it is also temporary because we cannot always rely on donors to come and help us. And we need to have very clear standards for providing prisoners with foodstuffs, with hygiene products, etc. Because today we have very general rules without specific numbers. We need to know the specific numbers, like, for instance, the specific number of soap bars that we need per prison, for instance, to ensure sufficient hand washing. We need to know the exact numbers of face masks or hand gloves. So we need to have some standards for these calculations so that in future, like next year, we would be able to ensure all these measures without the donor assistance. So this is something that we need to learn lessons from. And again, if we speak about prison staff, we do not have any norms in the country envisaging provision of soap, hand washing facilities, or gloves to the prison staff. There are no rules regarding such things, and that's why when we say that adequate hand washing should be ensured among prison staff, we never know what it actually means in figures because we do not know how many soap bars it actually takes. And this another problem that has been long been there is the lack of information, lack of data about other diseases, not only COVID-19, because this COVIDization, as we call it now, actually even killed those good healthcare services that existed in prisons. Like, for instance, previously, prisons could contract physicians, the prisoners could actually hire doctors to come and provide certain assistance. But today, because of the stricter restrictions, we no longer have this opportunity. And also, we have, by the way, high COVID rates among civilian healthcare staff, among doctors and nurses, which means actually that we have a lack of medical staff because these people are isolated, they are quarantined, they do not work. That means that the pool of people who can go to the penitentiary and provide help is also narrowed. Also, in mid-April, for instance, the country ran out of methadone. That means that actually there is no resource to sustain the substitution therapy program. And when we faced that system in April, we decided to enter into agreements with the Ministry of Health, the Ministry of Justice, and some international donors to ensure the import of methadone from abroad to the country. And that was really a good example of cooperation between the Ministry of Justice, Ministry of Health, and international donors to address this very serious problem. Also, I think the joint trainings are very important. I really like the instructions that have been elaborated for police officers. And when I visit, for instance, temporary facilities for migrants, or when I visit, for instance, the facilities of the Ministry of Defense, I always tell them you can take these guidelines elaborated for the police and use it as a basis to elaborate something for adapted for your needs, because this is really very important. This is a good document, but of course only a document would not work. You need to support the document with money, with resources, and with capacities, also including human capacities, because as usual, there is no capacity at the level of facilities that would enable them to see the problems clearly and to elaborate measures to address these problems and to take into consideration the healthcare needs, human rights needs, and elaborated really adequate measures. The capacity needs to be built. And for these joint trainings would be really, really very important. And one more thing, during the trainings that we have had for the prison staff, we ask them to voice the problems they face. And of course, we all today understand that COVID is here to stay for quite a while. And we know that, of course, contacts with family members is good, but prisoners do need physical contacts as well. That's why, together with uh, ONDC in Moldova, we try to make arrangements in prisons, maybe isolated rooms where the visitors and prisoners could meet, where the prisoners could meet also with their lawyers. These are so-called safe meeting rooms. So we are now considering this implementation of this practice. And we are also considering the possibilities to enlarge the capacities for online meetings. Thank you very much, Svetlana. Now, David, the floor is yours.
Methods were already highlighted. I want to once again highlight the importance of mass and periodic testing in the institutions, prioritizing in the country testing capacity to understand that we need to prioritize both prisoners and both the staff, and also to join the efforts and to join the idea that all kind of measures, restrictions should be human rights-based approach, starting from the planning and implementing. I want to highlight the importance of the independent monitoring bodies countrywide that can have the access, of course, considering the mechanisms and the protective mechanism that they can use. And once again, the accumulated knowledge to transfer from knowledge to the protocols and the instructions for everyone to be understandable. Once again, deepen the cooperation between the state healthcare agencies and the penitentiary healthcare institutions, and to give this supervisory role and to be in constant communication with each other. And still very important thing is to still work on the access to the personal protective equipment. And also I think the idea that can be like food for thought, as they say, for future vaccination, for example, how we are working in our countries to prioritize the future work towards the working against the COVID, and how we are going to effectively advocate for the accessibility and availability of the vaccines. I think this is something that we can have a discussion in half a year or in 1 year, to understand how we were effectively working in this kind of situations, and how we made and what we have done and what our governments have done in this regard in the fighting against the COVID, so using the vaccine that we have. And also we are kind of talking about the COVID like something in the future, like in the past, but I think that we need to also reinforce and re-advocate current to the government that this is something very emerging, especially in case of Armenia, for example. This is something that needs to be very priority, especially in the institutions of where there are people more vulnerable, and to work closely with the international organizations, NGOs, and the state bodies and the institutions.
Thank you very much, David. I want now to thank all the experts for participation, sharing experience, and also sharing their observations. And I want to thank the audience who have been listening and watching us. Thank you very much, and see you soon.